Welcome to Physio T3. Introduction. Thorax forms the upper part of the trunk of the body. It not only presents boarding and lodging for thoracic viscera but also provides necessary shelter to some vital abdominal viscera. The trunk of the body is divided by upper part right pointing arrow called thorax, lower part right pointing arrow called abdomen. The thorax is supported by a skeletal framework, thoracic cage. The thoracic cavity contains two vital organs. 1. Lungs right pointing arrow principal organs of respiration. 2. Heart right pointing arrow circulation. Surface landmarks of thorax. Bony landmarks. 1. Suprasternal or jugular notch. It lies at the level of the lower border of the body of the T2 vertebra. It is felt just above the manubrium and between the sternal ends of the clavicle. 2. Sternal angle of Lewis. It is felt as a transverse ridge about 5 cm below the suprasternal notch. It marks anteriorly. Manubriosternal joint lies at the level of second costal cartilage. Posteriorly, disc between T4-T5 vertebra. The ribs are counted from this level downwards. 3. Xiphisternal joint. The costal margin on each side is formed by the 7th to 10th costal cartilages. Between the two costal margins, there lies the infrasternal angle. The depression in the angle is also known as the epigastric fossa. 4. Costal cartilages. The second costal cartilage is attached to the sternal angle. The lateral border of the rectus abdominis joins the costal margin at the tip of the 9th costal cartilage. The 10th costal cartilage forms the lower part of the costal margins. 5. Ribs. The scapula overlays the 2nd to 7th ribs on the posterolateral aspect of the chest wall. The 10th rib is the lowest point, lies at the level of the L vertebra, lumbar vertebra. 6. Thoracic vertebral spines. The first prominent spine felt at the lower part of the back of the neck is that of the C7 cervical vertebra or vertebra prominens. Below this spine, C7, all the thoracic spines can be palpated along the posterior median line. T3, thoracic vertebra spine, lies at the level of the roots of the spines of the scapula. The 7th thoracic spine lies at the level of the inferior angle of the scapulae. Soft tissue landmarks of thorax. 1. The nipple. The position of the nipple varies considerably in females, but in males it usually lies in the 4th intercostal space about 10 cm from the midsternal line. 2. Apex beat. It is visible and palpable cardiac impulse in the left 5th intercostal space 9 cm from the midsternal line. 3. Trachea. It is palpable in the suprasternal notch midway between the two clavicles. 4. Midclavicular plane. It is vertical plane passing through the midclavicular point, the tip of the 9th costal cartilage and middle of L clavicle. 5. Mid-axillary line. It passes vertically between the two folds of the axilla. 6. Scapular line. It passes vertically along the inferior angle of the scapula. Shape of thorax. The thorax resembles a truncated cone which is narrow above and broad below. The narrow upper end is continuous with the root of the neck from which it is partially separated by the suprapleural membrane. Point 2. The broad or lower end is completely separated by the diaphragm from the abdomen. In transverse section, the thorax is reniform, bean-shaped, or kidney-shaped. The transverse diameter is greater than the anteroposterior diameter. However, in infants below age of 2 years it is circular. In quadrupeds, the anteroposterior diameter is greater than the transverse. In infants, the ribs are horizontal and as a result the respiration is purely abdominal, by the action of the diaphragm. In adults, the thorax is oval. The ribs are oblique and their movements alternately increase and decrease the diameters of the thorax. This results in the drawing in of air into the thorax called inspiration and its expulsion is called expiration. In the adult have both abdominal and thoracic respiration. Skeleton of thorax. The skeleton of thorax is also known as the thoracic cage. It is an osseo-cartilaginous, elastic cage which is primarily designed for increasing and decreasing the intrathoracic pressure, so that air is sucked into the lungs during inspiration and expelled during expiration. Formation. Anteriorly, by the sternum. Posteriorly, by T1-T12 thoracic vertebrae. On each side, by 12 ribs with their cartilages. Each rib articulates posteriorly with the vertebral column. Anteriorly, only 7 upper ribs articulate with sternum through their cartilages and these are called true or vertebrosternal ribs. 8, 9, 10 ribs join the next higher costal cartilage. These ribs are known as vertebrochondral ribs. The anterior ends of 11th and 12th ribs are free. These are called floating or vertebral ribs. Last 5 ribs are also called false ribs because they do not articulate with the sternum. Costovertebral, manubriosternal joints are present at the thoracic cage. These joints permit movement during breathing. Superior aperture, inlet of thorax. The narrow upper end of the thorax, which is continuous with the neck, is called the inlet of the thorax. It is kidney-shaped. Its transverse diameter is 10 to 12.5 centimeters. Anterior-posterior diameter is about 5 centimeters. Boundaries. Anteriorly, upper border of the manubrium sterni. Posteriorly, superior surface of the body of the first thoracic vertebra. On each side, first rib with its cartilage. Partition of the inlet of thorax. The partition is in two halves, right and left, with a cleft in between. Each half is covered by a fascia, known as Simpson fascia. Apex is attached to the tip of the transverse process of the C7 vertebra. Base is attached to the inner border of the first rib and its cartilage. Structures passing through the inlet of thorax. Viscera. 1. Trachea. 2. Esophagus. 3. Apices of the lungs with pleura. Large vessels. 1. Brachiocephalic artery on right side. 2. Left carotid artery and left subclavian on left side. 3. Left brachiocephalic veins. Smaller vessels. 1. Right and left internal thoracic arteries. 2. Right and left superior intercostal arteries. 3. Right and left first posterior intercostal veins. 4. Inferior thyroid veins. Nerves. 1. Right and left phrenic nerves. 2. Right and left vagus nerves. 3. Right and left sympathetic trunks. 4. Right and left first thoracic nerves as they ascend across the first rib to join the brachial plexus. Muscles. Sternohyoid, sternothyroid and longus colli. Inferior aperture, outlet of thorax. The inferior aperture is the broad end of the thorax. The thoracic cavity is separated from the upper end of the abdomen cavity by the diaphragm. Boundaries. Anteriorly. Infrasternal angle between the two costal margins. Posteriorly. Inferior surface of the body of the 12th thoracic vertebra. On each side. Costal margin formed by the cartilages of the 6, 7, 8, 9, 10 ribs. Diaphragm at the outlet of thorax. The outlet is closed by a large musculotendinous partition called the diaphragm. The thoraco-abdominal diaphragm separates the thorax from the abdomen. Structures passing through the diaphragm. There are 3 large and several small openings in the diaphragm which allow passages to structures from thorax to abdomen. Large openings of diaphragm. 1. Vena cavale opening in the center, to the right of the median arcuate ligament. 2. Esophagus opening in the right crura of diaphragm. 3. Aortic opening behind the median arcuate ligament. Structures passing through the diaphragm. Small openings. 1. Superior epigastric artery passes in space of Larry present between slip of xiphoid process and 7th costal cartilaginous slip of the diaphragm. 2. Musculophrenic artery perforates diaphragm at the level of 9th costal cartilage. 3. Lower 6 costal vessels and nerves pass between costal origins of diaphragm and transverse abdominis. 4. Subcostal vessels and nerves pass behind lateral arcuate ligament. 5. Sympathetic trunk passes behind medial arcuate ligament. 6. Greater and lesser splanchnic nerves pierce each crus. 7. Left phrenic nerve pierces left cupula. Large openings in thoraco-abdominal diaphragm. 1. Opening. Vena cava. Esophageal. Aortic. 2. Situation. T8 junction of right and median leaflet of central tendon. T10 splitting of right crus. T12 behind median arcuate ligament. 3. Shape. Quadrilateral. Elliptical. Rounded. 4. Structures passing. IVC. Right phrenic nerve. Lymphatics of liver. Esophagus. Both vagus trunks. Left gastric vessels. Aorta. Thoracic duct. Azygous vein. 5. Effect on contents. Dilation. Constriction. No change.